A number of people have said, can you just give us the difference between partial knee replacement, resurfacing, and I suppose partial and total is fairly obvious, but can you just what exactly is changing in the knee when you do these things?
So, gosh, look, we've got a knee just
Funny
here.
old thing, that.
How interesting. Okay, so if I just I'm glad you mentioned that, because in many ways the hip world has learned the difference between resurfacing and replacement. So obviously we know our sportsmen have hip resurfacings, Andy Murray, and that's a cup over the top of the head of the hip. And in many ways, total knee replacements are always total knee replacements, but partial knee surgery has become much more resurfacing. And literally, the most common one we do is the medial side, this side here. So literally, you will have a shaped piece of cobalt chrome, usually, over the front of this femur. The meniscus is replaced by a plastic meniscus, which is clipped into a little base plate that sits on top of the tibia. So these are more commonly now called a partial resurfacing. A partial knee is the other way we're talking about them. But when we want to talk about our skinniest ones, we're talking about, that is our thinnest implants, we're talking about a resurfacing there.
Right. Okay. And when you do a total replacement, how much of the knee are you lopping off in order to stick in the prosthesis?
So you will lop off the pretty much the whole of the surface of the femur. You'll cut a little box here for the surface, for the little mechanical mechanism to substitute the cruciate. And you take about 9 millimeters of tibial bone here, because you have to get a little tibial base plate in with polyethylene. So you are removing a substantial, if you like, chunk of the knee, although most of the knees nowadays will keep the cruciate ligament, the collateral ligaments that run down the side. With a partial, you're probably taking off a couple of millimeters of bone to put your resurfacing on, a couple of millimeters tibia, and of course the rest of the ligaments remain the same.
You said most of the knees will keep the collaterals. If you're taking away the cruciates, I mean, I struggle to see how the knee would function if you don't have collateral.
So some of the models, we're getting a little bit more technical now, but for some people who don't have great stability, we can adapt the design of the knee so it substitutes not just for the cruciates, but for the collaterals as well. And that gets into much more like the picture I showed of the hinge knee, not that particular one, but we can actually design stability into the knee, so we don't need the collaterals if they're damaged.